Toxoplasmosis. Toxoplasmosis, caused by the Toxoplasma gondii parasite. Symptoms. The majority of individuals infected with toxoplasmosis remain asymptomatic, unaware of their infection. However, some may exhibit flu-like symptoms, such as fever, headache, skin rash, swollen lymph nodes that may last for weeks, muscle aches, symptoms of eye disease. Toxoplasma parasites can infiltrate the inner eye tissues, a condition known as ocular toxoplasmosis. Poor vision, eye pain, untreated eye disease can cause blindness. Effect on people with weakened immune systems. People with weakened immune systems are likely to have more serious disease from toxoplasmosis. People at risk include those living with HIV/AIDS, people receiving cancer treatment, and people with a transplanted organ. In addition to serious eye disease, toxoplasmosis can cause severe lung or brain disease for a person with weakened immunity. Rarely, the infection can show up in other tissues throughout the body. Effect on fetus or infant toxoplasmosis can pass from the mother to the fetus during a pregnancy. This is called congenital toxoplasmosis. Infection during the first trimester often causes more severe disease. It also may result in miscarriage. For some babies with toxoplasmosis, serious disease may be present at birth or appear early in infancy. Medical problems may include too much fluid in or around the brain, also called hydrocephalus, severe eye infection, irregularities in brain tissues, an enlarged liver or spleen. Symptoms of severe disease vary. They may include problems with mental or motor skills, blindness or other vision problems, hearing problems. Babies with toxoplasmosis do not show symptoms, but problems may show up later in childhood or teenage years. These include return of eye infections, problems with motor skill development, problems with thinking and learning, hearing loss. To see a doctor. If you are planning a pregnancy or are pregnant, see your provider if you suspect exposure. Causes. Toxoplasma gondii is a parasite that can infect most animals and birds. It can only go through the entire cycle of reproduction in domestic and wild cats. These are the main hosts for the parasite. Immature eggs, a middle stage of reproduction, can be in the feces of cats. This immature egg allows for the parasite to make its way through the food chain. It can pass from soil and water to plants, animals, and humans. Once the parasite has a new host, the reproduction cycle goes on and causes an infection. If you're in typical health, your immune system keeps the parasites in check. They stay in your body but are not active. This often gives you lifelong immunity. If your immune system is weakened later in life, parasite reproduction can start again. This causes a new active infection that can lead to serious disease and complications. People often get a toxoplasma infection one of the following ways: cat feces with the parasite, contaminated food or water, undercooked beef, lamb, pork, venison, chicken, and shellfish are all known carriers of the parasite. Unpasteurized goat milk and untreated drinking water also may be carriers. Unwashed fruits and vegetables. Contaminated kitchen tool. Parasites may be on cutting boards, knives, and other utensils that come into contact with raw meat or unwashed fruits and vegetables. Infected organ transplant or transfused blood. Rarely, toxoplasma parasites are passed through an organ transplant or blood transfusions. Prevention. Certain precautions can help prevent toxoplasmosis. Wear gloves when you garden or handle soil. Wear gloves when you work outdoors. Wash your hands with soap and water afterward. Don't eat raw or undercooked meat. Don't eat raw shellfish. Do not eat raw clams, mussels, or oysters, particularly during pregnancy. Wash kitchen utensils thoroughly. Wash cutting boards, knives, and other utensils with soapy water after contact with raw meats or unwashed fruits and vegetables. Wash your hands thoroughly before and after preparing foods. Wash all fruits and vegetables. Wash fresh fruits and vegetables before eating, peeling, or cooking. Don't drink unpasteurized goat milk. During pregnancy, do not drink untreated water.
على كوكا الموجود وانا بقول حاجه ما حصلتش بس على كوكا الموجود.
Would like to thank both Uf Mohammed Gamal Hanna, Mina Mohammed, Rimandi, Yohanna Sameh, Mariam Fayed, Mariam Salam, Gamal El Said.